Hello viewers, this is Dr. Abdul Qayyum. Welcome back to my series of videos on cancer topics. It happens very often that people ask me what are their chances of having breast cancer. Also, this is a question of some of my patients in clinic when they wonder what are the chances of their near relatives to have breast cancer. Today we will review the factors associated with the high risk of breast cancer. Proven factors which predispose to increased risk of breast cancer include, of course, being female. Also, the age is related to the high risk of breast cancer. The incidence of cancer increases with age. Strong family history is related to the risk of breast cancer. Now, by family history, we mean the breast cancer or ovarian cancer in the close family members only. Now, the estrogen exposure during the whole life, which starts from early menarche to late to from menarche to menopause, also is related to the risk of breast cancer. Longer exposure to estrogens with early menarche or late menopause predisposes to higher risk of breast cancer. Um, Old age at the first childbirth is also a factor predisposing to high risk of breast cancer. Hormone replacement therapy is associated with high risk, as well as the history of chest wall radiotherapy, possibly because of previous breast cancer or for another reason. Some benign, non-malignant, non-cancer changes in the breast also predispose to the high risk of breast cancer, and of course, genetic mutations when present, some of these predispose to high risk of breast cancer. We review one by one some of these. Now, one factor which I forgot to mention is race. Now, being white puts you at higher risk of breast cancer than being colored. Afro Americans have more cases of triple negative breast cancer, which is one form of more dangerous type of breast cancers. But Afro Americans have more breast cancer at younger age as compared to the white fellows. Now, I mentioned about the age and the risk of the breast cancer. Now, to elaborate more on that, the risk increases with the age, and we can see on this chart that the risk being lowest at the age of 1 to 50 being about 2%, and in practical meaning, it means about one woman in 50 will have breast cancer. It increases gradually to about 7% in women who are above 70 years of age, meaning one woman in 14 will have breast cancer. The lifetime risk is approximately 13%. Now, relative risk is a term which we use the risk of a patient with a higher with a factor of high risk as compared to the risk of the same type of cancer in someone who doesn't have this high risk factor. The relative risk is lower than 2 with the high risk factors of early menarche and late menopause, and if the patient or the indicated person doesn't have any child. Hormone replacement therapy is associated with less than 2 relative risk, and postmenopausal obesity is also associated with less than 2 relative risk. The relative risk is between 2 to 4 with strong family history, check mutations, and if age is more than 35 years at first childbirth. Similarly, proliferative breast disease, which is a non-malignant, non-cancer change in the breast, is associated with relative risk of 2 to 4. The relative risk is quite high, being more than 4 with some genetic mutations, particularly BRCA gene mutations, with LCIS, which means there is a non-malignant or pre-cancer condition in the breast, and also sometimes breast changes which are earlier than the cancer changes are found in the breast, and if there is a history of previous radiotherapy. Considering all these risk factors, um, into one picture, several models have been designed. Most famous one is Gale model. This is based on current age, age at menarche, age at the first live birth, number of first degree relatives with breast cancer, and number of breast biopsies performed, and also presence of non-cancer, pre-cancer changes in the breast. Now, I have presented all these risk factors in a table form. If someone is interested to have a look at that, basically it describes the relative risk which I have mentioned earlier. Being obese in the postmenopausal age group is also a high risk factor, and this is also associated with high chances of death from breast cancer. It's also related with high insulin level in the blood and high bone basic metabolic index. Reverse is true for premenopausal, where obesity is not associated with high risk of further breast cancer. There are few factors which are associated with decreased breast cancer as well, and these are having mastectomy done in the past for any reason, um, good physical activity and weight control, and weight loss, particularly in the women who belong to postmenopausal group. Some factors which are very commonly, the patients ask about these factors in the clinic, but these are not proven to be related to risk of breast cancer, and these are low vitamin D, taking aspirin, taking more fruits and vegetables, taking antioxidants, and caffeine. Thank you for watching this video. Subscribe if you like the video.